Hello and welcome to Aston Health Matters, the podcast that shines a light on the latest health-related research and innovations from Aston University. My name is Saira Hussain and I'm your brand new host. I'm a clinician by background turned academic and I teach healthcare science students. Today we have a really exciting topic that is close to my heart and also one that I had the opportunity to be involved in, the HELP study, which stands for Hearing Loss and Patient-Reported Experience. So why hearing loss and why does it matter? Well, actually, it's one of the biggest health conditions that will be affecting many of us as we grow older. Hearing loss can impact your ability to communicate at work or at home. It can impact education and so much more. So it's really important. As someone that's worked with people with a hearing loss and have family members with a hearing loss, I'm really pleased to be able to share this topic with you today. This is a huge project that was funded by the National Institute for Health and Care Research, and it spans lots of clinics, disciplines, patient groups, and so much more. And so I'm really excited to share with you this and let's hear more about it. I have my wonderful colleagues and collaborators here today to share more. So I have Dr. Helen Pryce, Dr. Amanda Hall, and Dr. Georgina O'Connell. Welcome to the podcast.
I'm Helen Pryce. Thank you for the introduction. And I guess in my day job, I am a reader in audiology here at Aston University, and that means that I get to do teaching across all our programs, and I get to do lots of really interesting research. And this was a project that I conceived back in about 2019, 2020, and had the privilege to get funded and therefore to pull a team together and lead through the 3.5, 4 years or so that we were gathering data on the project. And we're just at the stage where we have completed our main findings.
Amanda.
Hi, my name's Amanda Hall. I'm a senior lecturer in audiology at Aston University, and I was involved in the implementation arm of the HELP study.
Thank you. And Georgie?
Thanks, Saira. I'm Georgina O'Connell, and I'm a lecturer and researcher at Aston University. And I was lucky enough to work as a researcher on the HELP project across all of the phases of it. And yeah, it was really enjoyable. And thank you for having me here today.
Wonderful. So, Helen, as the lead for this project, can you tell us a little bit more about why the HELP study and I guess why now?
Yeah, sure. So our background obviously is in kind of clinical audiology, and we were interested in the fact that we know quite a lot about what people do and don't hear when they come to see us. And we know a bit about what they can and can't do as a result of what they can and can't hear. But what we don't know is how that actually is experienced by the people who have the hearing loss themselves. We know that there's variation between people, so two people can have identical levels of hearing but have quite different kind of functional behaviours and stuff that they can do as a result. Some people hear better in noise than others, even with the same level of hearing, for example. But what we haven't ever known actually is what it is like for people when they have a hearing loss. And that matters because when you have a hearing loss, for the most part, you are going to be living with that hearing loss for the whole of your life. So we were interested in exploring what the commonalities were that people experienced. And initially, what we set out and imagined we might find is that there would be stark differences in the way in which people experienced their hearing when they were, say, in their teens and 20s compared to midlife and then into older age. And in fact, the funny thing was that what we learned was that there was incredible similarities in the experiences that people had. So we wondered whether we would need to think about things very much as a sort of life stage. In fact, it turned out we didn't, that the experiences that people had not really been captured by any kind of routine measurement or anything like that up to now.
So, Helen, can you tell me a bit more about that?
So typically, a clinician will measure what someone hears, and they might measure what impact that has in terms of what they can do. Can they hear speech in certain conditions? What are the levels of speech? And they might ask them some general questions about how that impacts their activities of daily living. And those sorts of measures are referred to as patient-reported outcome measures, or PROMs for short, and they're quite well known within audiology and wider health delivery. It's quite normal to use a patient-reported outcome measure to measure patients at different stages so that you can see if your intervention has had any effect with them. What is less common, but also really important, is to measure the experience that somebody has of both living with their health condition and of experiencing the service that a health clinician is providing. And so that was what we set out to do. We wanted to fill in that missing gap about understanding what it took of patients to be able to achieve those outcomes, and what experiences they might be having that were important for clinicians to know about. So what we set out to do was to find a way of, first of all, understanding what that experience was, what it consisted of, and we modelled it. Then we went on to develop a tool called a patient-reported experience measure as a result of the model.
Gosh, Helen, that is a huge project. And I could be biased because I was involved in this as well. But as a clinician and someone that's got family members with a hearing loss, I remember thinking, gosh, it's so weird that no one has ever spoken to people and thought about what is it like. And you can have these preconceived notions, and you do have lots of experience, or I have lots of experience with patients. But it's great to see this being done in a systematic way at such a national level. So you mentioned that there was lots of different stages to this project, looking at this PREM, and thank you for defining that as well. So can you just talk through, I guess, the three sort of phases of this project?
So we linked a whole bunch of separate research studies together into what we described as work packages, and that means that the work packages that were designed to answer one question at a time, but they might use a bunch of different methods to do so. They might use a number of linked studies to do so. So, for example, our first work package was concerned with identifying, defining, describing what patient experience of living with hearing loss and receiving care for hearing loss actually was. And to conduct that, we did a number of different interview studies, including with individuals who were affected directly by hearing loss themselves, but also by their friends and family, the clinicians who work with them. And we've also been able to find some really useful and important novel findings about, for example, what it's like for adults who have hearing loss, who grew up with hearing loss from childhood, telling us about what it was like to be a child with hearing loss. We've also got carers telling us what it's like to live with a family member with hearing loss, and so on. So we've got a whole load of different studies, if you like, that fall under each of these work packages. So that was the sort of main first bit, was very exploratory. The second part was concerned with developing the tool itself. And then the third part was principally concerned with implementing and considering the likely applicability of our new measure in clinical practice. And I was very lucky to work with these guys who led these stages.
So, Georgie, let's hear from you with work package 2, as we're describing this. This is led by also Aston's Professor Rebecca Knibb. So tell me about this PREM that we've...
Thanks, Saira. So for work package 2, that was the phase of the work where we looked to develop the questionnaire, the PREM. To do that, we went through different stages. So we started out by working with the findings from the first phase that Helen just talked about, where we'd developed a model of what it was to live with, what it was like, to live with hearing loss. So we took some of that data and we developed some questions to go onto our PREM. Once we'd done that, we then went to some other stakeholders. So it was a very collaborative process where we looked to to refine the questions that we had got from the first phase, from the literature and from the interviews that we'd done with people with hearing loss. So the next stage, we asked people with hearing loss to look at the questions that we had. We also asked clinicians, family members, and we had our PPI group as well, patient and public involvement group, look over the questions that we had, and they told us questions that they thought worked well or didn't work well. The next stage of that was to then do what we call cognitive interviews or think aloud interviews. So we sat with people with hearing loss as they completed our questionnaire. At that point, I think we had 27 questions on it, so it was very lengthy at that point. And they told us about certain questions that maybe didn't feel like they were phrased right. They told us if the responses didn't fit with the way that certain questions had been worded. So it meant that we were able to refine the questions based on the experience of people with lived experience of hearing loss, and make sure that the questionnaire made sense and was based on their experiences. So once we'd got our first version of our PROM, we then looked to check if the questions we had were able to actually measure systematically the experience of hearing loss. So at that point, we did a survey, and on that was the 27 questions that we'd developed at that point, and there were some other questionnaires on there as well that asked about loneliness, uh, decision making to do with healthcare and things like that. And we had a really great response. So we had over 400 participants take part in that, which was phenomenal. And we had to close that early because it was such a fantastic response. And I think that tells us something that, people want to talk about their experience of hearing loss.
Wow, Georgie, that is a huge amount of work. And the fact that we've got so many participants, I think, is brilliant. I'd love to hear more about sort of how you reduced those 27 questions down to what we have now as My Hearing Prem.
Yeah, sure. So we used statistical analysis to refine the questionnaire. So we got it down to 16 questions on our final version of the long version of the questionnaire. And within that, there were these 3 subscales. So we had emotional impact. So that was talking about the experience emotionally of living with hearing loss in everyday life. Then we had the communication subscale. So that was asking people about their experience of communicating with others, whether that was family and friends or healthcare professionals. And then we had the support subscale, and that included questions around the type of support that people had gained, again, from family and friends or from hearing care healthcare professionals. So that meant that we had a 16-item questionnaire. We also then went on to develop a shorter questionnaire that had 9 items, but still covered the same concepts, the same 3 concepts of emotional impact, communication, and support. And this was useful for clinics where they might be short on time and appointments. So this meant that they had a shorter version that they could ask patients to complete.
Fantastic. I think as someone that has worked clinically with these PROMs that Helen mentioned earlier, so looking at the areas that patients are struggling in, they might say they're struggling hearing their neighbour or not being able to hear in a group environment. And so if we go down a route of fitting hearing aids, for example, we then check in with those patients and see how often are you wearing them, how often or how well are you doing now in those situations. And I think what the PREM really highlights is that difference in terms of those questions that we do ask in our history. We get to know our patients quite well. And I think the PREM really captures that. So thank you so much for talking us through that. Georgie had mentioned PPIE, so patient and public involvement and engagement. Why was that so important? Because it seems to be such a strong feature in this study. Can you tell me more about that?
Absolutely. So it is a really important feature of our study, partly because any work that we do as health researchers needs to have a relevance and significance to the people who are going to be end users and consumers of it. And also we need to know questions to do with our research, like, is what we're making acceptable? Is it appropriate? Are the types of questions we're asking, for example, culturally sensitive in different languages? Is there even a way to translate certain concepts that we've got in our questionnaires? Things like that. So with that in mind, we organised our PPIE to give us access to lots of different individuals with lots of different perspectives on the subject. So we were lucky enough to work collaboratively with some of our local lip reading groups and to go and meet some individuals in those sorts of group environments who could then tell us, about lots of aspects of our measure and our work and our interpretations that we were coming up with. But we also went and spoke to adult learning disability groups. We also spoke to South Asian community groups, for example, to ensure things like translatability and aspects like that. We also took our measure and went straight into residential care homes in the Birmingham area, for example, to ensure that something in that context would be meaningful and useful to residents in those care homes, so that we were accommodating or thinking about and sensitive to the additional cognitive or communication needs that an individual might have when they also experience hearing loss. So we were so grateful to our PPIE contributors, because they really did influence the nature of the questions that we asked, the way we phrased them, and ensured that we could be confident that what we were coming up with at the end of the day was going to be meaningful to a range of communities.
Thank you. Just to clarify, patient and public involvement is separate to all the participants that we had. And I think being able to go in such diverse, I guess, communities, areas, settings, so it's not just a focus on that clinical side, it is a focus on, well, I guess, for anyone and everyone that may have a hearing loss.
Absolutely, exactly. So we were very keen to make sure that we included the widest number of participants throughout this study. So we had lots of people who didn't have access to audiology or weren't choosing to go and consult with audiology or audiology services at all, who were also involved in this study all the way through, as well as people who were uh, in the act of receiving treatment or were part of a clinical group as well.
And I think being able to, I guess, share and discuss things rather than present to or talk at. And I think that's such a sort of an important ethos that ran through this whole project. Amanda, tell me more about how are we getting this into clinics, or how were we working with clinics all the way through?
Thank you, Sarah. Great question. So, what we did from the very beginning of the study, in parallel to the other work that was going on that you just heard about, we were thinking about the implementation from the very beginning. So, we were thinking about, and we were working with our clinical collaborators. We were working closely with 3 clinical sites, 3 audiology and hearing therapy departments that had agreed to be involved in the trial of the PROM in practice. So one of the things that we identified early on from our clinical colleagues is that not everybody understood what a PROM was and how it differed to the PROMs that we've been talking about. So one of the things that we had to integrate into some of our early material that we were planning was to explain what the difference was between a PROM and a PROM. We also talked to patients thinking about the implementation. So what would we need to, what sort of material would we need to support implementation when we were asking patients to fill in a PREM in clinical practice? So did they understand what the purpose of a PREM was, and what their maybe any challenges they might have in filling a PREM in, any issues that we might need to address from their perspective? And we took those findings to put together a package of materials to support implementation in practice, which included making some videos, making some infographics, making some explanatory materials, and then checking in with people what they thought about those materials to then use those alongside the fully developed PREM when we got to that stage.
So thanks, Amanda. You really showcased that actually getting this integrated into clinics very early on was so important, and I guess not an afterthought. It was part of the wider help study. So you mentioned these clinics that have been involved in this project. How have they been getting on?
So we had 3 clinics that we were working with, as I explained before, and each of them trialled using the PREM for 3 months, and we followed what happened over that period of time. And we looked at how that process was from their perspective, but also from the patient perspective. And I suppose a couple of key findings, really. Firstly, from a patient perspective, we had overwhelmingly positive feedback about how patients valued having that opportunity to be able to tell clinicians about their experience as well as their outcomes. But also, it was a reflective tool. A number of patients told us they found it a really useful tool to enable them to reflect on their experiences and maybe to think about things that they hadn't considered were related to not being able to hear as well as they used to. So patients found that um, a really positive experience from their perspective. And clinicians as well, a number of clinicians found it really helpful to be able to maybe have a slightly harder conversation than they maybe would typically. So to be able to tackle some of those issues around what the experience was like for patients rather than maybe those more standard outcome measures.
Okay, but playing devil's advocate, Amanda, these 3 clinics were obviously quite invested. They were part of the project. What about all the other clinics across the UK that are only just starting to learn about this? How do you think they're going to get on?
Well, we've got a number of resources out there to help them. So we've got a fabulous website where clinicians can go and download information about the PREM, download the PREM. We're working with our professional society to disseminate this widely. We have also got it implemented into the electronic patient management system that most audiology departments use. So they will be able to readily access this and integrate it into their appointments as they see fit. And we've been talking to a number of departments, and we've got ongoing interest, and we continue to spread the word and let people know about it. And there's definitely interest and excitement about using it in practice.
Fantastic. Thank you so much, Amanda. So, Helen, really, how is this helping your everyday patient, your everyday person with that hearing loss?
Coming here today in the train, I was mindful of, the impact of not being able to hear a station announcement, not being able to hear a platform change, how that makes you feel that you're not in charge of that, you can't control the environment as you might like to. We then have the challenge of how you then, you're communicating with somebody close to you, and sometimes those people get annoyed with you because you're not always hearing or behaving the way they would expect. And so there's all sorts of layers of additional experience that people with hearing loss have all the time, regardless of whether they're using hearing aids or not. And it's really important that we are sensitive to that. We capture those data and we are able to make changes in our clinical practice resulting from that. So, one of the things I was excited to see as an example is that as a result of knowing about the type of emotional response that patients were experiencing, some of our patients were able to engage in a group led by hearing therapists where they talked about that. They talk about what it's like to live day to day in this way. And that's great help. You're not alone. It suddenly shows you that you can have a connection with people on this, and you're not alone in that regard. And that can be really, really helpful for people. There's also lots of benefits for the clinician. So the clinician noticing the sorts of things that people were putting down on their form, where they have issues with communication, for example, was able to direct them to an appropriate community lip reading group, or to think about supplying them with other environmental aids, assistive listening devices that you can get to help you hear some other situations. So, flashing lights for your doorbell, things that will keep you safe from a fire alarm, things that will enable you to access sounds around you. Practical things about how to hear television better, stuff like that. Those are the things that when you're the person with the hearing loss really matter at the end of the day. Arguably, they matter even more than what the level on the hearing test says.
Thank you. So the PREM really is to help enhance, the practice that is already there. We have, fantastic audiology professionals across the country that are supporting patients, and this will just help them I guess, to do that a little bit more and really hear from patients, no pun intended.
And just to add, it's a useful tool to use for people with hearing loss with their loved ones as well, because it can highlight certain challenges that they might be facing in their everyday life that maybe they weren't aware of prior to completing this questionnaire, because it gives them a structured way of thinking about their emotions and how they're communicating and the support that they're getting from their loved ones as well. So it can be a really useful tool to open up conversation with their family and friends about their everyday experience of living with hearing loss. So it's a really useful tool outside of the clinic as well.
Thanks, Georgie, for sharing that. I think that's so important because I guess when somebody thinks about a health related condition, it can often feel like they're alone in doing that. And actually, they live with people at home. They go to work, they see lots of other people that might be that could support them on this journey. So, thank you so much for highlighting that. I guess my next and last question is, what's next? Amanda?
Well, we've learned a huge amount about developing a PREM in terms of involving the full range of patients, public, clinical stakeholders, wider members of the community, and we know how to do it, and we've learned lots of things we hope to take forward, and we're really keen to develop a PREM now for the paediatric population for parents of deaf children, and ultimately we'd love to do this for deaf children themselves to complete. But also we've learned a huge amount which should be of interest to those across other health conditions about developing and implementing PREMs in clinical practice.
So we will also be attending the World Congress of Audiology 2026, where we will be presenting this project, this work, the PREM, to an international audience. So that's really exciting. That's taking place in South Korea. So we're very excited to attend that and to share the work that we've been doing internationally. We've also received some interest from doctors in the US who are excited to try using the PREM. So there's a lot of international engagement and interest about the PREM, which is really exciting to see what the next steps are for this.
Thank you so much to yourselves, Helen, Amanda, and Georgie, for your time today and sharing, this 6-year-long, fantastic national project. It's been so insightful, and again, not just because it's in, I guess, my world. There's so many transferable things that you've also been able to share, and I'm very excited to see where this goes next. So, thank you. Thanks for listening to Aston Health Matters, and we'll see you next time.